Hello, ladies and gentlemen. Welcome to this afternoon session, Gender, Inclusive Health and Leadership in Africa. Happy International Women's Day. With me is a very diverse team of panelists, and we have Anuradha Gupta. She's the Deputy CEO of Gavi. We've got Kenewendo. She's the former Minister of Trade and Investment in Botswana, but also the Managing Director of Kenewendo Advisory. We've got Kene. He's the Policy Specialist on Human Rights Law and Gender with the UNDP, but also last but not least, Dr. Iris Mwanza, who's the Director of Community Health Roadmap and also the co-chair of the Women in Global Health Gender Equity Hub. With you as your moderator is me, Dr. Ndifanjina Maja, and I'm also Malaria No More UK Youth Ambassador. This is a very diverse panelist we have today, and being someone who's very passionate about ending malaria, but also being a leader in the field, I'm just excited and I'm looking forward to learn from this amazing panel this afternoon. Happy International Women's Day, everybody. Now, just to start the conversation this afternoon, I'm going to start with you, Anuradha. What is the one small example you see in your everyday work of why you think women's leadership in health is important?
Hi, everybody, and what a wonderful question to start with. I think leadership in health is about protecting lives and promoting well-being of individuals, families, and communities. A very big responsibility that comes with limited budgets. In my view, women are gifted with a paradoxical combination of courage and compassion and an uncanny ability to do more with less. COVID-19 has again highlighted the leadership mettle of women, their foresight and ability to weigh the economic, social, human implications of decisions, their effectiveness in connecting with people and communities and establishing trust with transparency and truthfulness. At Gavi also, we have seen how female leaders have brought new perspectives and shaped Gavi's strategy, policies, and programs to become much more equitable and inclusive. In fact, the 2021 Global Health 50/50 report released today reviews how organizations are working to maintain their commitments to gender equality and social justice, particularly in this period of crisis. Gavi is in the top 5% of over 200 organizations active in the global health space. And this is really the fourth consecutive year that we have been rated among the top performers.
Thank you very much for that, Anuradha, and thank you very much for bringing the Gavi perspective. I'm going to come back to you on that one. And for now, I mean, Anuradha just brought up an important perspective about protecting lives. And with protecting lives, we look at the family, we look at the male being involved in protecting lives. And I'll present the same question to you, Kenny. Why do you think that women leadership in health is important?
Well, a lot of the issues that I deal with in my work affects women. If you look at HIV, for instance, on the continent, and who has borne the brunt of that epidemic, women and girls have borne this very disproportionately. And if you look at the spaces where decisions are made, my work entails looking at laws and the impact of laws on epidemic responses. Many of the laws on HIV are very gender biased against women. There are a number of other issues in the legal system that impact women negatively. And so if you have a space where women are not in the room making these laws, making the decisions, shaping programs and policy, the effect is that programs, laws, the environment for response to health issues inevitably impact women negatively. So it's important to have women's leadership in these spaces so that their issues and the right perspective on policies and programs to address them are included in those processes.
Thank you very much, Kenny. And you have brought up an interesting perspective on policy, and I would definitely be back to you on that so that we build up more on what the men can do to have gender inclusive policies that are being developed. But just going back to you, Dr. Iris, you are part of the Global Health Equity Gender Hub, and I just wanted to know from you, what is that one example of your everyday work of why you think that female leadership is very important in regards health?
Well, so regarding my work, gender inequality is an inextricable part of community health. So community health workers are predominantly women. In Africa, 7 out of 10 are women. And while they are providing essential services, including throughout the COVID-19 pandemic, they're often underpaid or even unpaid. And research shows that the loss is $1.5 trillion in unpaid work by women each year in the health sector alone. That's trillion with a T. So, you know, gender equality isn't just the right thing to do. It's the smart thing to do. In fact, it's the necessary thing to do if we're talking about economic development. So this transcends even our topic today, which is, you know, sort of rooted in global health. This is really a matter of economic development.
Thank you very much, Dr. Iris. Now, to you, Kenewendo, I just wanted to get your perspective coming from the political field. How do you feel that female leadership, women leadership is important in shaping everyday health policies? What is your take on that?
Thank you very much. It is a pleasure to be with you all today. It is very important to have women leadership in politics, because they will then help to shape the conversations around issues that matter the most to women and to children. And I can just give living examples of when there are active women in parliament, in councils, then you start to see the bills that are being proposed, the motions that are being tabled in parliament leaning towards issues of health for women, around economic empowerment for women, the protection of children and women's rights, and which is something that we did quite actively when we were in parliament. And it is testimony. We're not saying you can't have male allies that can deliver on these issues, but you seem to have them more prominent, prioritized in agendas of women leaders. And again, you know, it may sound like a cliche to many others now, that when you empower one woman, you empower a whole nation, a whole community. But it is really true, and you see it by the issues that are being presented in parliament, in council, when there are women representatives. And again, just to add to that, it's important for diversity of thought. Just have one thinking, one homogeneous thing, and assume that you'll be able to tackle all the issues that are in a particular country.
Thank you very much. And Rada, when you brought up the 50-50 Global Health Report, and when we look at that report, it says that 73% of the Global Health executives are men, with only 5% being women from low to middle income countries. I mean, I just wanted to present that to you. What does that mean for the gender inclusive agenda when we look at those figures?
Yeah, so I do feel that this is a situation that needs to be corrected sooner rather than later. And if I take my own example, I think I have been able to play a leadership role first at the country level and then in global health, because I have seen firsthand the struggles that women face in all parts of the world. In my home country, India, for example, millions of women face multiple compounding vulnerabilities. Girls suffer from crass neglect since their birth, do not attend or complete school, get married as children, lack agency or any power over their life and decisions, and are simply unable to realize their full potential. Being a woman, I have related to these struggles, and that is what has embellished my leadership. This has deeply inspired me to follow a career path that can help alter this reality. And through everything I have done, I have tried to lift those who did not have the same opportunity, giving them an extra voice and championing their cause. For example, you know, when I led education, I helped enact a landmark legislation to guarantee free school education to girls and scholarships for their higher education. Because education, I really believe, gives wings to girls to fly high, and employment gives them financial autonomy. And I use my leadership to expand opportunities for women, for example, by organizing self-help groups, improving access to microfinance, you know, strengthening their livelihoods, strengthening measures to prevent domestic violence, and by improving access to sexual and reproductive health. So a lot of that I brought into Gavi, and today we see that translating into our work. Now, for example, 60% of staff at Gavi are women. You know, we became the first global health organization, not for profit, to actually achieve equal salary certification. And our recently adopted new gender policy stresses the importance of gender transformative approaches. And as has been just said, you know, we are focusing not just on empowering female caregivers, but also female health workers, because 70% of health workforce is females and adolescent girls. And really also the importance of making men a part of this effort. And I do want to emphasize that point, that for women, the journey to new heights or leadership heights should not be a lonely one. They say behind every successful man is a woman. Likewise, behind every successful woman should be a man. The reality is that in the absence of such support, women have to shoulder a disproportionate burden of invisible, unpaid work, both at home and workplace. And I really think, I'm sure if you speak to a lot of women leaders in this space, they would tell you how they had fathers or husbands or partners or brothers who cheered them on and who really supported them in their different roles. So I don't think women empowerment should be an agenda of women, for women, by women. And I just think it's important to remember that.
Thank you very much, Anuradha. You brought up very important points, like behind every successful woman is a man, and that talks about the fathers, that talks about the brothers in the community. And I'm going to present this to you, Kene, because we have a lot of African men who would like to be a part of this gender equality, but they don't know how they can be a part of it. They don't know what barriers surround this. So what role do you think the African man can play to increase awareness on the challenges and forms of discrimination that women face?
Thanks. And I agree with Anuradha. There is so much that we can do as men generally and as African men. And you know, it's one thing to believe in gender equality. And if you ask most men and most African men, off the top of their heads, they would say, we believe in gender equality. But then moving actively to advance this agenda is where the issues get a bit tricky. And so, I think personally, one thing that we can begin to do as men, as African men, is to be a bit more attentive to the spaces where we occupy and how women are included or excluded from these spaces, how they are engaged or not engaged in these spaces, whether it's in the panels that we organize or set up, in the meetings in our offices, the research teams, the boards, even in the decision-making in our homes with our daughters and our spouses and our mothers and all the women around us. Who is being included, whose voice is being elevated, who is being silenced, whose opinions are being affirmed. These are things that we would notice. We would notice the gender dimensions of this once we begin to pay attention. You know, the UNDP's 2020 Gender Social Norms Index found that close to 90% of men and women hold some sort of bias against women. So this is everywhere. And within my department, you know, we've made a decision at work. I mean, we've made a decision not to organize or participate in male-dominated panels. And you will truly be surprised the difference this makes. Walking into a room and affirming the point that your female colleagues make on the team makes a whole lot of difference. So that's one thing. And then generally speaking, challenging gender norms and cultural stereotypes about men and women in our communities, especially in the spaces where we gather as men. Oftentimes, even the best champions of gender equality in the workspace retire into these community spaces that are male dominated, whether it's in clubs or bars or wherever. And we are silent in the face of sexist jokes. We do not challenge this. So there is a role for African men to play in challenging stereotypes and negative social norms and supporting the women in our lives to be all that they can be.
Thank you very much, Kenny. And, you know, Anuradha and Kenny have just really brought up different perspectives of the conversation. And it just brings me to one of the conversations of the triple burden that women experience. So women have the reproductive role, and Anuradha did point out sexual reproductive health issues. So we have the reproductive role, we have the community role, which also brings in the cultural expectations that Kenny has talked about. And we've got that corporate and social responsibility that we're also expected to fulfill. And I just want to present this to you, Dr. Iris. How has your gender impacted your life and opportunities? Looking at this, the triple burden that women are faced with, how has your gender impacted some of the life opportunities and some of the achievements that you have overcome?
Thanks so much, Difanji. I want to start with a quick story that started a generation ago. So a generation ago in Zambia, where I'm from, boys were educated while girls were not. So my father, Jacob Wanza, was able to go to school and ultimately get a PhD from an Ivy League university, while his sisters, who were equally brilliant, were not. And because my father was educated, so was I. But this has really shaped my outlook. And what I see out there isn't just a story of lost opportunity, you know, in the Mwanza family. This is the story of millions of women and girls today. And we really need to break that cycle. So, you know, I think that as Anuradha was saying, I've been extremely lucky because of what happened because my father was a boy, was born a boy. That has really given me all the opportunities that I have had, whether it's educationally and career-wise. But, you know, I can tell you for free in Difanji, there's a lot more work that needs to be done.
Yeah, that is very, very true. And I was actually telling my best friend earlier that, you know, as we talk about women empowerment and girl child empowerment, we should not forget the boy child, because that also has an impact on the sort of females and the sort of generation that we bring up. And I like how you bring up that perspective of how your father's education also sort of paved way for your own future as well. So as we talk about gender equality and parity, we should not forget the boy child. Have you back, Kenewendo. Looking at your life, you were the youngest minister. You were appointed minister at 30 years of age, and arguably the youngest minister on the continent at that time. Politics is a dirty game. I have been involved in politics myself, and I know how male-dominated the political field is. I wanted to know, what would you want to tell the young girl out there who aspires to become like you? What message do you have for them? What would you want to tell them? What would you want them to learn from your path? I mean, I was watching your TEDx talk, which you did in Cape Town, and you brought up an interesting perspective on how history erases women. Women are easily forgotten from history. And what message do you have for the girl out there who is listening in and wants to learn from you? What do you have to tell her?
Well, I think this session would be too short for me to share all of that. But first, let me apologize. I will not be able to get my camera back on. We have suffered serious technical challenges here in my office. So the one thing would be, regardless of how old you are, just get started on your journey. Remember, leadership is not just in politics. If you want to be in politics, you have to start quite early in your leadership, in your personal leadership journey. Know what it is that you stand for, remain rooted in that, be deeply rooted in your principles and your morals, such that when you finally get into politics, you know, you have that solid foundation that can help you navigate the politics a lot better, because it is so easy, incredibly easy to get lost in the tide, incredibly easy to get lost in the institutionalization, in the culture. But it's up to you what it is that you want to achieve. And if you have a very clear vision in that, then set forth, start. If you're not being embraced now, start, they will catch up, because impact work excellence speaks for itself. And if you're a young woman, young African woman right now, this is certainly your time. The world is looking for an African face. We're seeing it everywhere. The world is looking for young leaders. And I have always said this, that actually, if you're young, don't let anybody tell you that you cannot be a leader in Africa, because youth leadership is African. The history is there. Look at whoever it was that led your independence movements in your countries. You will see that they were young. So take your time, find your leadership journey and embark on it.
Thank you very much. Impact and excellency will speak for itself. I really like that. And I just want every girl there to just write that on their wall. Impact and excellency will speak for itself. Sometimes you don't have to even make noise. Your actions are going to take your word out there. And Anuradha, you did bring up an interesting point on Gavi and how 60% of your staff are female, they're women. But as women navigate around these institutions, there are inequalities that Iris talked about, pay inequalities. I mean, she was talking in trillions of dollars. So we've got pay inequalities, inflexible policies, and even sexual harassment. We've read cases of institutional sexual harassment. I wanted to know from you, and perhaps even maybe give us insight on what Gavi is doing to identify these barriers, but also what measures are institutions putting to overcome these pay inequalities, these unfair policies that are going on in the institutions.
Yeah, so if I reflect on what are the key success factors, right, behind making Gavi so gender equal and also our work very gender responsive in countries, is that we have a policy of giving equal representation to women in our board, all our governance committees, management structures, and leadership positions. And I do think that equal participation of women in decision-making roles is so necessary to provide impetus to identifying and challenging discrimination barriers and glass ceilings. So that's something we have done extremely well. And then the next step that we took is to work systematically to develop and embed gender equal policies, processes, and practices, and reinforce them from the top. You know, really the tone has to be set at the top, and then it has to be followed with very concrete actions and behaviors. So what we actually did was to apply a highly intentional 6 R's framework. You know, this is my favorite framework to bring gender balance to our work at Gavi. And these 6 R's are recruitment. So as I said, we recruit women, we make sure that our recruitment processes actually don't have any gender bias. And that is why at each of the 8 career steps that we have at Gavi, including senior leadership positions, we have women equally represented as men. And that's huge, right? The second R is remuneration. And I mean, we know that there is a gap in salary, you know, for women. This was alluded to. But as I said, we are an equal salary employer certified for the last 3 years. So we are just so immensely proud that we have policies which make sure that remuneration, because women are not good at negotiating their salaries. So we do make sure that it doesn't go against them. Third is rewards. You know, so making sure that recognition and rewards have equal representation of women. So when we do our performance assessments, we look at our ratings systematically, making sure that women in no way are discriminated. Respect. So people alluded to now safeguarding sexual harassment. So I think just investing in nurturing a culture that hugely respects both men and women, I think is so important. As a result, we actually have had no complaints of any kind of inappropriate behavior towards women. And then reporting, I think that's important. Data is sexist, right? So anything that we do not value, we don't care to measure. But this is important. And therefore, we have 13 gender indicators that we actually report on and monitor very carefully and present to our board. And then reinforcement, as I said, reinforcing that message over and over again, I think is extremely important.
Thank you very much, Anuradha, for, I think Gavi is clearly one institution to learn from. I mean, we've just learned about being intentional, having a systematic approach. And I also learned in one of my courses that if change is not led from the top, then there's not going to be any change at all. And I like how you have brought up that perspective of the leadership at Gavi being intentional in closing out the gender gap. And you know, with this, we're hearing a lot about policies, we're hearing a lot about sexual reproductive health and discriminatory laws. I want to present this to you, Kenny. You know, much of your work at UNDP centers around discriminatory laws, policies on women living with HIV and other vulnerable populations. How does gender-based discrimination intentionally, and how does gender-based discrimination affect policies in regards gender issues on the African continent? What do you think that we can do to make progress towards universal health coverage? What steps can advocates take to challenge this discriminatory issues on the continent?
Thanks, Ntafaji. You know, we've learned from HIV and the experience that issue-specific laws can be helpful. But if you do not address the broader legal realities, and by that I mean laws, the text of laws themselves, and the implementation of those laws or lack thereof, there is only so much that can be done to move the agenda forward. So the question to ask, for example, is what's the broader legal environment? Take UHC, for instance. In many of the countries where we work, we see colleagues, we see stakeholders being very intentional about the gender dimensions of UHC policies, but it goes beyond these issue-specific legislation. Looking at what inheritance laws, for instance, in your country looks like. Do you have a legislation around unpaid labor, which affects women disproportionately? Can women secure access to land and land rights? You know, how does inheritance law in a country impact the opportunities that exist or do not exist for women? So you could craft the best issue-specific laws, but if you don't look broadly at the gender dimensions of the legal environment, there will always be these impediments pulling women back. So in the context of HIV, for instance, how does the criminal law impact women and what categories of women? We know that from the latest data, 62% of new HIV infections are among key populations and their partners. And this includes people who use drugs, sex workers, transgender persons, gay men and other men who have sex with men. On the continent, we see that many laws and policies touch on these issues. Sex work, drug use, same-sex sexual orientation. And these laws become an impediment even for the best of HIV programs being effective. So we need to look more broadly at what the legal environment looks like. It's also important to understand, especially in the context of Africa, that we have more than one legal system operating in many of our contexts. So we have the formal legal system and the laws made by Parliament, but they exist side by side in many of these contexts with traditional or customary law, religious legal systems, and often there's a lot of incoherence across these legal systems that impede progress on women's empowerment and gender equality. And so looking at resources that have cast some kind of light on how to address this. And for this, I'll refer us to the work of the the Commission, the Global Commission on HIV and the Law, which looked broadly at how legal systems, the enforcement of laws impacts HIV with specific sections on how they impede progress for women, young people, young girls generally. In the context of COVID-19, if I may, we have also seen that countries have responded with COVID-19 with a flurry of laws, and many of these impact women negatively. We have a database, the COVID-19 Law Lab, you can look it up, where we're trying to track legislation from across 190 countries to be able to monitor the trends and apply the lessons we've learned from other disease responses and make sure we don't replicate the mistakes we've made around gender inequality and entrenched stereotypes that have ended up impeding progress on these diseases responses, but also on global health more broadly.
Thank you very much, Kenny, for those points. Now, just remind our audience that you can pose questions to the panelists using the chat feature. But before we go on further with this conversation, I'd like at this juncture to invite Dr. Natalia Kanem, Executive Director of the Unfpa, to give us her remarks on this day. Over to you, Nicole.
My dear friends, happy International Women's Day. I'm very pleased to be with you for this important conference that intends to break barriers towards gender-inclusive health and leadership in Africa. I thank Dr. Gitinji Gitahi and AMREF Health Africa for showing that Women's Day is to be celebrated by women, by men, and across genders. When women lead, things change. Throughout the COVID-19 crisis, women have kept entire societies going. They have sustained health systems as the majority of frontline health workers and courageously managed extra responsibilities at home in caring for the ill and for children out of school. Women have kept shelters open for survivors of violence against women, and they have scaled mountains literally to distribute contraceptives. In my visits to countries where UNFPA works, I see inspiring women pushing for change, including young leaders, people like Immaculate Oliet of the Network for Adolescents and Youth of Africa. Adolescent pregnancy was on the rise in Kenya's Kisii County, with insufficient resources devoted to family planning. Some stakeholders were reluctant to broach the topic of family planning. It can be a contentious issue among policymakers, but not Immaculate. She and her team sprang into action, bringing advocacy, bringing advocates together in a coordinated effort to influence county budgets and policies and to increase access to contraception. And it worked. The county government has continued to progressively increase its health budget above the 15% called for in the Abuja Declaration, with record allocations to family planning. Every day, women around the world offer vivid, unforgettable testaments to the value of their leadership. Why then does gender parity in leadership remain so elusive? Women make up 70% of health workers worldwide, yet men account for over 70% of the global health executive ranks. And just 5% of executives are women from low and middle income countries, according to the Global Health 50/50 report. Because of the roles women play in their communities, they're often in a good position to spot local public health trends, including those that would foreshadow an outbreak. However, during the COVID-19 pandemic, in most cases, women have not been fully engaged in decision-making and the planning and the implementation of prevention and response efforts. Only 3.5% of national COVID task forces have gender parity, according to a study in the British Medical Journal. It's no surprise then that the vast majority of programs to prevent and address the health impact of COVID-19 largely ignore the role of gender. Many obstacles still block women's path to leadership. One of the most fundamental is the lack of bodily autonomy. Many women cannot make basic decisions about their bodies, such as whether to have sexual relations or not, whether to use contraceptives or not, or even to make their own healthcare choices. No woman should be denied these choices. Yet we see 1 year into the COVID-19 pandemic, how crises can exacerbate existing barriers that hinder the ability of women to exercise their bodily autonomy. Sexual and reproductive health services were shuttered or scaled back across the globe, and gender-based violence skyrocketed. A woman who cannot realize her bodily autonomy, a woman who cannot say, "My body is my own," may face compounding barriers to equality throughout her life, undermining the range of rights and choices required to become a leader. Dear friends, the Africa we want is a continent where powerful women play their rightful role on an equal footing in all spheres of life. To achieve the Sustainable Development Goals by 2030 and the aspirations of Agenda 2063, Africa must harness the skills, the energy, the potential, and creativity of all its citizens. The more women and adolescent girls have agency and decision-making power over their own bodies, the more they are enabled to participate fully in their community, society, and economy. The more they will contribute to Africa's growing prosperity and the pursuit of human rights. Within the health sector, what I am asking you to do is to identify stigma and gender discrimination. Do your part to end the shaming of women who step forward. We must all commit to removing legal barriers to quality care for all, including women and girls and people in all their diversity. One key step is ensuring adequate investments in family planning that women so desperately want and need, and in maternal and neonatal health care. Certainly, it is long past time to stop violence against women, and as the United Nations Secretary General Antonio Guterres has said, to make peace in the home a reality for every woman and girl. Laws criminalizing domestic violence must be enacted where they do not exist, and they must be enforced where they do. And efforts to address violence against women need to be adequately funded. Commitments to gender equality mean little without the financial resources to back them up. All over the world, women lead. They lead peace processes, run businesses, head labor and environmental movements, establish hospitals and schools, often while caring for their families and communities. Women's leadership. Let's celebrate it, replicate it, and above all, support it not just today, but every day. There's an African proverb I love, and it says, "When women rise, mountains move." Let's hold hands and walk into a future, all the way into a world where every woman is able to govern her own body and her own life. Let's move mountains.
Wow, powerful remarks from Dr. Natalia Kanem. When women rise, we move mountains. We've got some questions here from the panelists, and the first one is actually to you, Dr. Aris. And I think this is specifically, it works for you considering what you talked about your childhood. So this is a question from Joseph. Joseph is saying, gender inequality in Africa is about culture. What should we do to eliminate it? How does religion and education come into play to widen inequalities, and how can we do to eliminate this? Over to you, Iris.
Thank you, and thanks for that question, Joseph. I mean, I think this really sort of starts at access to very basic things, access to education, access to health. And while Kene was talking about laws and policies, oftentimes, even when we do have law and policy that touts equality, the reality on the ground is quite different. And so really, I think part of it, one pathway, at least the pathway for me, was education. That was very important because that helped me navigate through and above some of these issues. I think as Anuradha mentioned, the ability to have income is also another layer of protection, because if you have your own, you can sustain yourself economically, that gives you a layer of protection regardless of what the culture is. But I think, really one of the most important things to do is to work together. This is the International Year of the Health and Care Worker. So while there's global and national attention on this particular issue, the call to action is to support gender transformative policies. So join women's groups, including local chapters of Women in Global Health, and support calls for, as we're talking about today, women in leadership. Join other women and men fighting for equal pay for equal work. Fighting for decent work, the protection from discrimination, sexual harassment, and fight for women in low status, low paying jobs. And this includes, for me and for others, community health workers who need to be recognized and paid for their essential services. So, I think it's a two-way thing. The reality is, as an individual, if you're lucky, you will have some capacity to protect yourself and navigate through patriarchal societies. But there are groups out there, lots of women's groups, and women and men should be encouraged to join collectively, because it is quite important. It's difficult to do things alone, but if you have millions supporting you globally, and these global calls to action and these particular moments, then we need to sort of try and be smart and creative about how we collectively are able to do this. But I really like also what Boholo was saying earlier about, don't wait. Go and find a way to do things, find a pathway, figure it out. And there are groups out there who are more than willing and able to support what you want to do. Thanks.
Thank you very much for that. So I picked up mentorship, having a community, and also one key thing is that an economically empowered woman is a powerful woman. So we need to encourage our girl child to pursue their education so that they're able to get the employment they need and they can self-sustain, because if you're able to self-sustain, then you'll be able to avoid some of the issues of gender-based violence that Dr. Natalia talked about in her remarks. We have a question here from Edith Milanzi. So this question is to Anuradha. So she would like to know, what did the Gavi do specifically for women employees during the COVID-19 pandemic to allow them to seamlessly work from home, considering that just working at home, like we already said about the triple burden that women experience. So working at home is already another responsibility. You're already working and you also have another employment going on there. What did Gavi do to make sure that women are able to seamlessly work at home during the COVID-19 pandemic?
So a number of things. What a wonderful question again. We were caught by surprise by the pandemic and lockdown, and suddenly we had to start working from home. So now for more than a year, actually, we have been working from home. So we haven't sort of compelled or encouraged our staff to come back to the campus. Though there were times when, there were some periods, where certain other organizations were getting staff back into offices. So that is one. The second is, I think what we did, and it was about messaging then again and setting the tone at the top, where, we started to communicate a lot with our staff. Every week, we would have all staff meetings, and we sort of, with the entire leadership, work to understand the individual circumstances of every member, every team member, because everybody's circumstances look different. So we had single parents, we had young mothers, we had, lonely people, who had nobody, and they were feeling very isolated. So there were all kinds of different experiences. And what we did was to completely deprioritize our deliverables. And we said to people, you don't have to, sort of focus on the deliverables that were set, a couple of months, because every year we have all these deliverables, but we became extremely flexible in setting of performance deliverables. We also became extremely flexible in working hours. So we saw that women were working, say, late in the night, 10 o'clock for 2 hours, and, but just the managers were constantly encouraged to be extremely empathetic of the circumstances of female staff members. And lastly, what we did was we did not have any differentiated performance rewards this year, because we wanted to really recognize those women who were true heroes. And, you know, in terms of work deliverables, they might not have done that well, but, you know, a lot of them ended up looking after their elderly parents, you know, young children. And so just in recognition of all that, it was uniform payment that we make to the whole staff. So in essence, just telling staff or making them feel highly supported and staying flexible, I think was our key to wading through this intense period of work, particularly for Gavi, because we were in parallel working on COVIX, which meant a massive undertaking in addition to our core work.
Yeah. And thank you very much for bringing up the vaccine. I mean, you are in the spotlight right now. Each and every nation, each and every country, each and every government is talking about the vaccines. Do you think it's any different if women are at the decision-making table in regards to health policies? Do you think it makes a difference?
It makes a lot of difference. And really, I don't want to take credit for this, but the point is that at the senior leadership level, it is 50% men, 50% women. You know, so we have equal representation. So what happens is that we met every week, right, to actually take stock of the evolving situation. And we actually put staff health and well-being on top of our agenda, right? Despite the fact that we were so focused on COVIX also. So it was COVIX, but it was the what, but it was also the how, you know, and just staying extremely responsive. And that's why I feel that women in leadership positions actually bring that empathy and that compassion and that ability to relate to the lived experiences of their women colleagues, right? And yeah, they'll have the ability to shape policies in a way that are highly balanced. So we delivered on our work, and but at the same time, we ran our pulse surveys. So we started to run pulse surveys, and you will be surprised that our pulse surveys showed high staff motivation despite abnormal loads of work.
Thank you very much, Anuradha. And it brings me to the next question, which I'm going to ask Dr. Arias. I mean, you know, Gavi has a 50-50 representation at the senior leadership level. But, you know, the interesting thing that has also been noted is that sometimes the women at the top also tend to pull their fellow women down. They're not happy to see the young women rise to also get a seat at the table. How can we resolve this discrimination or this fight that is actually not influenced by the males, but it's actually women on women, females against females, pushing each other down, pulling each other down? How can we overcome this?
Well, I have to say, Difanji, I've not experienced that in my own life. And I think that there is more discussion about it than truth to this. I mean, I'm sure there are individual and unfortunate incidents of that kind of behavior. But I think in my own life and career, I think women have been extremely supportive. And, you know, I've had women mentors and men, but mainly women who have been extremely helpful in helping me navigate my own career. So I think, you know, part of it is, you know, when we talk about dismantling the patriarchy, I think part of it is also addressing some of these negative stereotypes about women and women leaders. And I think we all know, and you know, some of us have also experienced some of the negativity that is attached to being a female leader, and how some of that can easily be amplified as in somebody who is not helpful or somebody who is not supportive of others. So I'm not sure, and I'm probably not the best person to speak about it, because I don't think that this is a generality. I think it's probably more the exception to the rule, but I think the dangerous thing is to perpetuate stereotypes like that about women in leadership. And also this then becomes an excuse for not supporting, you know, more women leadership. And we know that, you know, when women are leaders, they actually perform equally well, if not better than men. And I think that the take home is really, we need inclusive leadership. So it's not just about women's rights. There's, you know, persons with disability. There's so many others that need to be brought to the table. Thanks.
Thank you. Thank you. Kenny, you bring in an interesting perspective. I mean, you're the only male on this panel, and usually things are in reverse. I mean, most of the job interviews I've attended, I'm actually the only female, you know, speaking to an all-male panel, and this is working in reverse. And you have done a lot of work around HIV and sexual reproductive health issues. I mean, I'm also very passionate in that area, as much as I also work in malaria. We know that women are disproportionately affected by issues to do with malaria. We know that pregnant women are the most affected. The under 5 children are the most affected. When we look at HIV, we also see that the adolescent girls and young women are disproportionately affected by HIV. I wanted to know from you, and from your experience working in the sexual reproductive health field, does it make a difference in policies if we have women at the table?
Oh, absolutely, absolutely. And I'll just give an example. If you look at age of consent laws, for instance, that exists in many of our contexts. Some of these are laws that that have not been reformed in decades, 40 years, 50 years sometimes, before independence. Not only do these laws not acknowledge the evolving capacities of young people, but in some contexts, there are differences in age of consent to service, to sexual relation between men and women. And so having women leaders on the table, bringing these experiences and these realities to the conversation makes a huge difference. Let's take what one other issue that's currently on the table in many contexts, and it's about what people call period justice. For instance, the fact that in many spaces men do not have any conversations, have no knowledge, are not socialized or trained at all around these issues, and yet panels and committees in Congress, in Parliament, making laws around essential commodities, funding and financing for them are completely male. And they do not understand what the real life implications for education that Iris talks about, for chores, for going to work in contexts where people are missing off work days because they can't afford some of these commodities. So it's, definitely, without a doubt, women's leadership, speaking to these issues and speaking to those experiences in ways that impact policymakers broadly and spark a positive conversation is very important.
Thank you very much, Kenny. And as a youth leader myself, I like to say that do not make decisions for us without us. It's very important to include the youth leaders, to include the women when decisions are made for them. We should not forget to include them at the table. With that, ladies and gentlemen, I'd like to thank our panelists for this amazing conversation, for sharing their experiences, the knowledge. It's been such a vibrant panel, and we've got great participation from the audience as well. Thank you very much. Anuradha, Kenny, Iris, and Kenny Wendo, who was not able to finish with us, but we started together, and also our keynote speaker, Dr. Natalia. Thank you very much for joining us. And like I said earlier, this presentation is going to be available on the website, and you may be able to follow through. Thank you very much, and happy International Women's Day.
Thank you, Ndifanji. Same to you.
Thank you.
Thanks, Ndifanji. Great moderation. Thanks, panelists. Iris. Cheers.